Hello everyone, my name is Candido Rodriguez. Today I will talk to you about GAD diagnosis. GAD is a generalized anxiety disorder. It's characterized by a persistent and excessive worry about a number of different things. People with a GAD maybe anticipate disaster and maybe overlying concerning about money, health, family, work, or other issues. So, individual which GAD found it difficult to control their worry. GAD is diagnosis when a person found a difficulty to control the worry on more days than not for at least 6 months. So person with a GAD has to have those worries at least 6 months. That's you're gonna consider that those person have this diagnosis. Although the exact cause of GAD is unknown, there is evidence that biological fact, family background, and life experience, particularly stressful ones, play a role on this diagnosis. So excessive use of caffeine, the person who take a lot of coffee, drink a lot of coffee, which can make existing angst even worse. The other aspect is the childhood abuse. So I want to also to add something very important on this. That's the sign of the symptom of the anxiety. What is the signs? People with this diagnosis usually feel very nervous and having a sense of independent danger, panic. They always thinking something's gonna happen with them. So having an increased heart rate, it is another problems for this diagnosis. Feeling awake or tired, people don't sleep very well and they wake up on nights and they feel always very tired, having trouble sleeping. So experience gastrointestinal problems. That's another symptom of this diagnosis. It is very important also to talk to you guys about the treatment option, because a lot of people ask those questions about what is my option, how I can treat this diagnosis. So you have a few options. All therapy help people change their relationship to their symptoms. So therapy is really, really good on treatments. So like relaxation techniques, meditation, yoga, exercise, and other alternative treatments maybe also become part of the treatment plan. So, what is the medication is the best for this diagnosis? What type of medication you can use it? That's other part of these treatments. So, medication, the antidepressant most widely prescribed for anxious, like SSRI, such as Prozac, Zolnf, or Lisinopril. It's a medicine they usually use on this treatment. So they have been used to treat generalized anxious disorder, what we call GAD, and then obsessive compulsive disorder, what is OCD, panic disorder, social anxious disorder, and post-traumatic stress disorder. Those meds you can use that on all of them. That's you thinking it would be appropriate. A lot of questions, a very important question that people ask the therapist all the times is if GAD can allow you to be disabled. So yes, in some point. So anxious disorders involving phobia, panic disorder, post-traumatic stress disorder, that we call PTSD, obsessive compulsive disorder, OCD, and generalized anxious can qualify as social security disability benefit if they are well documented and